Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hi, everybody. It's Jessa, back for another episode of the Better Sex Podcast. Thank you for tuning in and sharing this time with me. I know you have probably a million choices of podcasts and a million other things that you could do with your time, so I appreciate you being here. Hey, as part of the conversation, or as part of my effort to bring helpful, meaningful information and ideas and inspiration that could help you transform your sex life, I am offering free monthly Q&A sessions, sort of an Ask Me Anything. I will do my best to answer. It's available, I do it twice a month actually, at two different times, sort of right near each other, just so hopefully you could make one or the other of them. This is available for free for everyone on my mailing list. So if you're not part of that elite group yet, you can go to bettersexpodcast.com and there's a Join Me tab. You'll see it there. And I would love to have you be part of the conversation. I'd love to, give you the chance to ask questions, get some information. And I suppose it's a chance for you too to also share with me what you would like to learn about on these shows, because I keep booking the most fascinating guests and I'm loving these conversations, but I'm also certainly open to input on what you want to hear about, what you'd like to learn, what would be helpful for you. So please get in touch. Today's topic, I didn't even really mean to cover it. It actually didn't occur to me until I was speaking with this guest, and this is the direction she wanted to go. And I am so glad she did, because this was a conversation I just found so powerful and so thought-provoking. And it's like such a oversight that we haven't talked about it before. The topic today is men's experience of birth and about the effects on sex and sexuality after birth. So men who are with a partner who is giving birth, naturally or not, and what that experience is like and how stressful it can be and the challenges there can be in integrating this later and the effects on their sexual life potentially. So not something I had given ing thought to, honestly, until talking to Amy Gilliland, who is a doula and a teacher of doulaing. I don't know if that's quite the word. A certified sexuality educator, somebody who's very, very active in birth training and birth support, and just has done a ton of research, read some research and done some of her own about this whole phenomenon, and especially the impacts on men. So I think you're going to find it really interesting. And if you are a man or you have one in your life and you are, there's babies involved or birth involved, I think this is going to be really powerful. Let me know what you think. Amy, thank you so much for being on the show today.
Thank you. I'm so happy to be here.
Yeah.
Excited to talk to your audience about all these things today.
I know. I think this is a fascinating topic, and not one actually I had thought about covering until you suggested it. So I really appreciate you reaching out.
Well, I think the first thing is that most people don't think about sex and childbirth together. We don't think about childbirth as being something that affects the sexual life unless you sit down and you really consider it and you go, oh, well, of course, it's the same organs, it's the same hormones, it's actually the same hormonal system that you use during sexual arousal that's also present during childbirth and in parenting. And that's not just for the birthing person, that's also for the supportive partner as well.
Yeah. So
they also are having a strong hormonal interaction and response to labor and to the new baby, but we never even talk about that.
Well, it's interesting because first, I think as somebody who's had babies, I think about birth and sex because I've gone through that and had some of the effects. And I did do a show already about postpartum sexuality. And actually we talked a little bit about both partners, but largely focused on the birthing person if somebody was given birth to a baby. So I
Right.
just really love this emphasis on what about the supportive partner, the other person and the effects on them.
Yeah, and almost all the research has been done on men. So rather than women as the supportive partner. So if we're talking about research, I'll probably use the word fathers or men interchangeably, simply because that's where the research has been done.
Okay.
And some of it would pertain to female partners in relationships, but also not, because our biology is different and our
Right.
gender conditioning and culture are different. And that affects how we respond to people in labor. The deeper I go into the rabbit hole of looking at the neurophysiology of sexuality and sex and how hormones affect behavior, especially when we're talking about love and attachment, the more I realize just how distinguished the two sexes are of male and female.
Huh.
There's certainly overlap in what our human needs are, but in terms of the way our brains are structured and what kind of behaviors are stimulated hormonally, and that women have hormonal pathways of oxytocin that during stress that men don't possess. And that totally alters our behavior, especially when you're talking about labor support and being with somebody who's in labor.
Okay, so today we're focusing mostly on men as these partners and their experience of birth and then post-birth, in terms of sexuality, right? So maybe I guess we'll point out if we remember, that it might apply to all genders, but largely focused on men.
And I also want to talk about the men who, when we get to that point, about who have difficulty with sexual desire or sexual attraction after watching their female partner give birth, because we don't talk. All we do is demonize those guys. There's absolutely nothing helpful. So I think as we go through the conversation, we'll develop a lot more compassion for men who end up feeling that way afterwards.
Right. Oh, so let's just start out with, you and I are both women talking about this. Like, what has brought you to have so much interest, and I guess I'd say compassion, around how men are treated in childbirth and sex? So
I think I have to start with me as a researcher, because I grew up in a family of all women. My father was not very present, and my grandfather was almost 70 when I was born. So I grew up in a family and a culture of all women. They sent me to a girls' school. They sent me to girls' camp. And so my understanding of men was never from this innate sense of having fathers, brothers, uncles, cousins. I understood women very, very well. Mm-hmm. And I went to my first birth by accident in 1980. I ended up doing a labor support. And after by accident. Right. Well, in 1980, if you couldn't reach somebody by phone, that was it. So we couldn't find her husband. Labor had started. And so I ended up spending the whole labor with this person. And I ended up with a lot of questions about why certain things were being done. Well, if the baby's coming out of her so quickly, why did they give her an episiotomy? And if she's having trouble breathing, why don't you just have her sit up rather than having her lay down and me give her oxygen? And if the baby's screaming bloody murder, why are you saying his lungs aren't mature? So, which is still some of the same issues that I run in today, almost 40 years later, in terms of obstetric care. And we're looking at, well, why are we doing the things we do? So when I got to grad school, it was only natural, after attending births with men for about 15 years, almost 20 years at that point. When I got to grad school, I was really curious about what the literature said about fathers and birth, and about what nurses' attitudes were when fathers started showing up in the delivery room. Because we went in a 15-year period, we went from men are not supposed to be in the delivery room at all. There's no place for them, to a total transformation of, well, you're going to be there and you're going to be responsible for all the labor support for this unmedicated birth now that she's having. And with absolutely no question asking of men, what do you need?
Yeah.
What is this experience like for you? What's stressful? What's difficult? How can we support you in it? And that question has never been asked of men, unless they have midwife or a doula who asked them that question.
Right.
I mean, and that is less than 10% of births in the United States today. So 90% of most men becoming fathers are not having a conversation with anyone about, well, what is this going to be like for me? What am I scared of? What's the hard parts? The hardest part is seeing one of the people you love most in the world in pain, and not being able to do anything about it.
Yeah.
Because your whole gender training says you should fix the problem.
Fix. Right.
Yeah, you can't, there's nothing to be fixed with a person in labor. There's just, you support and you exist in that space and whatever they're doing. But that's not a natural gender cultured behavior to just witness or be present with someone.
Right.
So it started with me wanting to do this literature review about, well, what were nurses' attitudes when this shift happened? And they were angry. I went back and I read the original literature written in the late 70s and the early 80s. And the nurses' attitudes were like, you've made my job harder. Because I used to have 6 women in one room. And if I was helping Mary, I could see Kathy and Susie across the room and be observing how they were doing with their labor. And now everybody's in an individual room, and now they've got a man with them, and this man wants to ask me a bunch of questions and wants me to help them. And I'm angry as a nurse because now you're here and my job is harder. And that was pretty much the attitude, and it was. And the culture kind of jumped on top of this, is that if you're going to be here, you better be worthwhile and you better be filling that coach role or be doing that labor support, because I don't have time to do it anymore. Out of that came birth family-centered maternity care in the 80s with the birthing room suite, and everybody's in one room rather than changing a labor room to delivery room. A lot more interest in an unmedicated birth or to lessen interventions with family-centered maternity care. And so, because kind of this supposed shift in accommodation for men, but still, all it did was we put pretty wallpaper up, but we never really focused on fathers, people becoming fathers and saying, well, what is this like for you? What's hard for you? What kind of support do you need? Instead, what happened was any emotional or social needs that he had became totally downplayed and crushed because she was in labor.
Yeah.
So whatever you were going through didn't matter because she was in labor and your job was to help her. But what ended up happening is, well, back in the 70s and early 80s, it was, our cesarean rate was 25%. Now it's 33%, almost 35. It's bigger than that in some states. So for those men, 1/3 of the time, their labor support ends in their partner having major abdominal surgery.
Right.
And that has huge implications for their sexual life later on, because some people do fine after cesarean section birth, but not always, especially once you get to the 2nd and 3rd cesarean birth. Then you're really looking at much more likely to have sexual consequences.
Right.
So for the person who's had the surgery.
Yeah.
And that's something we also don't talk about. So
goodness.
So I got interested in 2005 as a grad student and then just kept it up. Back then there were about, I think I read 140 papers back in 2005. And since then it went from about 20 papers being published a year to 30 or 40 on fathers' experiences of birth. So we've got this huge wealth of knowledge now about what it's like, but it hasn't shifted anything educationally or in our cultural conversation.
Wow.
Unless you've been listening to what I've been saying for the last 5 years.
Right.
We really,
What sounds interesting is there have been these changes that I would say are positive towards less intervention, less medication, the family-centered birthing room, I don't know what the stats are on home birth, but there have been these developments in birth that seem very, very positive to me. But I'm hearing your point that we've kind of left men out of that process. I mean, as we've made these advances, they haven't necessarily been for the support partner there.
Right. And how men are dealing with their partner's labor definitely affects their labor.
Yeah.
People who are coping beautifully with their birth, they're not having trouble with their pain, but it seems out of control to the male partner. So he will want her to get an epidural because it makes him feel better.
Oh, gosh.
So we've got, I see that all the time. I did a little study with labor and delivery nurses last year. As I said, can you please list all the reasons besides pain that people get epidurals? And most of it has to do with lack of support, but a very strong number of those responses are because it makes the male partner feel better.
You're bringing back memories, actually, as you say that.
Fixing the problem. Well, when somebody has an epidural, they come back from their limbic system into their cerebral cortex because human labor and birth is a limbic system process, just like sexual arousal is. You have to leave that questioning, thinking part of your brain and going into the feeling and sensory part.
Yeah.
And so if you're not familiar with spontaneous labor behaviors, you think there's something wrong.
Right.
You know, and it feels chaotic and out of control because it's unfamiliar. So, you know, what our research shows very, very clearly, and this is studies that I've done and also the research reviews I've done, is if a male partner has access to a doula, so there's doula support, or they're getting one-on-one care from a midwife, whether that's at home, in the birth center, or in the hospital, when they get that one-on-one care, then they adjust much better because their questions are answered. Their anxieties are dealt with in the moment. When we look at the PTSD studies about who are the men who end up with post-traumatic stress disorder from the birth, and that number is rising, it's because of their cognitive appraisal of what are they seeing, that they don't know how to understand what they're seeing or make sense of it. So that just leads to a great deal of more stress.
Wow.
And because they don't feel good initiating asking questions to medical staff, and medical staff has got 10,000 things to do that if they don't have to answer a question or give an explanation, they're not going to because of their time pressures on their job. That, you know, if a man doesn't initiate, he's just going to end up thinking there's something wrong or end up in this state of hyperarousal with a lot more stress hormones, a lot more catecholamines. And that tends to lead to post-traumatic stress disorder 3-4 months down the line.
Wow.
Yeah. It's really, I mean, to be able to see, okay, this is where it starts and this is what the results are of it has been quite fascinating for me.
Yeah. So is a short birth better than a long birth? Is there research about that? Like if this whole thing goes like a whirlwind, is that maybe more traumatic?
I think it depends on how much the father knows ahead of time about birth and how much, because that education and somebody there saying, yeah, this is normal, or this is what we like to see, or this is unusual, but it's not abnormal. You know, like having that sense of like, oh, how do I frame this? That makes a big difference. The number one thing, it doesn't matter how long or short your labor is. It doesn't matter how many interventions you had. It doesn't matter whether you use pain meds or not. What matters is, did the birth happen with you or did the birth happen to you? And the more people are involved in decision making, and especially the more male partners are brought in on that decision making process, the more likely to have a sense of control, and the more likely they are to be satisfied with the birth later on, no matter if it took 3 hours or 30 hours, or you had lots and lots of pain meds or none at all. You know, you just got in at the top. It doesn't matter. What matters is, was I a part of all the decisions that happened to me? And that's true for both partners.
Yeah, I was going to say, certainly that would be true. You know, as I'm thinking back on my own births, right? That would have a huge impact.
There's a rule of thumb there, and that is, was the person in labor treated were they treated as a laboring couple, or were they treated as a laboring person with the partner present?
Yeah.
Because that partner present versus being treated as a couple is huge. And a lot of times, I mean, you've got race and class that come in and intersecting there too in the American hospital system and how people are treated. But I know, because I work a lot with our communities of color here in my state, that Black men say, I'm much more likely to get ostracized.
Yeah.
Or they address to her, but not to me, even though we're married. They don't see us as a couple. That happens, that sense of being left out. It happens to all men, but Black men are the men who are more likely to talk to me about that. Yeah. Whether that's because they are Black and we're having this discussion and I'm listening, but I've heard it from white men too, but I hear it more often from Black men, that they're more likely to be left out.
But I'm also thinking that the whole process leading up to the birth is part of that too, right? That the couple is making these decisions together, that there's a lot of, designing your birth plan or whatever. You're trying to anticipate and make a lot of decisions that are shared ahead of time. That might have to change, but that involving men in that whole process probably goes a long way to them feeling involved.
Most people think that your nurse is going to spend a lot of time with you, and your nurse spends maybe 30% of her time with you and 75% outside of the room.
Yeah.
The odds of you seeing the same practitioner, if you've been seeing an obstetrician, that you're going to see the same doctor during labor and birth, they're extremely low.
Right.
Because we often share call with where I live, we have 14 to 18 people sharing call.
Wow.
So the odds of you running into the same doctor are very small.
Yeah.
So you're going to be dealing with a bunch of strangers in this really, really intimate experience. And you're in a strange environment. So when we think about it as a sexual experience, we've set it up in mostly the antithesis of what people would want in terms of intimacy, dim lights, being with people that they know in a familiar environment, not being up on the stage, which is the bed with all the fluorescent lights focusing on your genitals. It's a very, it's been very medicalized, but that doesn't mean that that's what helps labor to flow best either.
Yeah.
Yeah. And so I train people to be doulas. So I train people to do labor support professionally. And one of the things that I talk about is how medical people come at this from a model where they're paying attention to the process of birth and not the person birthing.
Yeah.
So that's the way obstetrics is that I don't want to get to know everybody. I'm paying attention to the process. So the fact that they've never met you before doesn't matter to them because they're basically technicians.
Yes.
But what couples want and what most people want in their medical care is they want to have a relationship. They want more what we call humanistic model of care.
Yeah.
That where we're two people and you're helping me to get through this. And we have a relationship that's based on our personhood, together. Even though you're a medical care provider, you're paying attention to my personhood. And so I think that's one of the things that men find first off is like, oh, wait, this isn't happening to us together. And
right.
two, we're not being treated as people or as being as a uniquely special couple. We're being treated as somebody who's going through a particular process in this medical environment. And we don't have as much say or as much leeway as we thought we would.
Right.
We're not being treated as unique individuals like we thought we would. So I think that's the next disillusionment. Studies have shown that people think that their nurse is going to spend 90% of their time with them. In fact, that's a study I would like to replicate to see if that's still true nowadays.
Yeah.
And so I think that's the other thing is that men think they're going to be able to ask the nurse lots of questions, and she's not there.
Wow.
So that's another area of disillusionment. Then they're trying to help someone, even if their goal was to lessen medication. No matter what it is, it's still really hard to see someone you love in pain.
Yeah.
And not be able to do something about it. And because that's really key, I think, to a lot of their arousal, even if it was a goal,
right.
And even if he is, very few men want to be in that partner role in labor support for a wide variety of reasons. I'd say it's probably less than 20%. 80% of men would prefer to be, they want to be engaged with the birth, but not necessarily with the labor support.
Yeah.
And for me, making that distinguishment between those two things is really, really important for people because he can be there 100% showing up and be present and yet not be doing a lot of hands-on helping with positions or washcloths or massages or stuff like that. That what men's biology tells them is that when they're under stress, they need to withdraw in order to emotionally regulate. And if you're the only one there to do labor support, you never get the opportunity to do that.
Right. Right.
Do it. So their arousal just goes up and up and up.
This is so interesting because I'm thinking, not having had these conversations before, I'm thinking back to my own births and, my poor ex-husband now that, and his fears and the stress. I mean, all of this is resonating, that was going on. And it seemed so crucial that I did have other birth support and he got to, like you said, be involved in the birth, but not be the primary support. And that probably went a long way.
Yeah, I think that's huge. Just be able to have some relief or to be able to joke with somebody or to be able to say, do you think this is okay?
Right.
It's like to be able to ask that question to someone and not feel like you're lessening your status.
Right.
Because that's the other thing is that because medicine is patriarchal, especially the way hospitals are set up, it's a male gender culture status hierarchical environment. And yet birth itself is a female gender culture environment.
Yes.
So men are automatically, okay, I'm in a state of disequilibrium because this is all women's stuff here.
Yeah.
And then men have a variety of comfort with women, female environments. Some are very comfortable, others not so much at all. And so that's the first thing. They're walking into this female environment, but yet they're still men. And to ask for help or to ask, I don't understand, puts them in a one down position. You know, every time they do that, in terms of what they've learned in terms of being a man and what my status is like, I want to show I'm competent as a father. I want to show I'm competent in terms of labor support.
Right.
So anytime you do those things, you're reinforcing that lack of confidence. And this comes from a couple of different studies that have been done in the UK, where they actually analyzed it looking at through male gender culture and said that these were very real concepts, behavioral concepts that men are bringing with them into the labor room. So it isn't just coming from me with this.
Right.
Hi, it's Jessa here, taking just a quick break. Thanks for listening so far. I wanted to let you know about the sex quiz that I've put together called How Healthy is Your Sex Life? I've taken a close look at the typical ways that I see couples get into trouble with sex, including avoidance, neglect, negativity, distraction, and boredom. And the free quiz will score your individual results based on these factors. And then I provide my recommendations and ideas, including my top 10 sex tips, which will help you make instant improvement. If you'd like to take the quiz and see how healthy your sex life is, you can do it right now at sexhealthquiz.com.
So how do men make sense of what they're seeing? Like, what are they? I mean, of course, births go all over the place, but what kinds of things affect them in this experience?
I think that there are men. I'm thinking about all the different studies. One of them is the Swedish one in 2012 talking about post-traumatic stress disorder. And the title of the article is, "There She Was, Lying Just Like Jesus on the Cross." I know. And that's
wow.
what when they walked into this cesarean room with her arms, tied down and saying, and that's what his reaction was. That's what his thought was. So you can imagine what preceded that day.
Right.
It was the thought that was stimulated.
Yeah.
So anything they don't understand. So I would say normal labor behavior, spontaneous labor behavior, why medical people are doing certain procedures, why they're doing them at that particular time, cervical checks and vaginal exams. I really like Esther Perel's talk about the primacy of the sexual bond in most couples, that your partner's body becomes an extension of your sexuality. Mm-hmm. When you're in a dyadic relationship that's closed, that's sexually closed, it's just between the two of you, that there is a sense of ownership. And I mean that in a positive way of this is my sexual territory. Your body is a part of my sexual territory because we are a unit as a couple. And what happens is when you go into the hospital environment and you watch your female partner spread her legs and somebody else sticks their hands in there, it's bizarre. It's unusual. Well, the whole act of doing a cervical check on a person and thinking that it won't have an effect on their brain is crazy, because in no other social interaction do we say, "Oh, hi, I've never met you before. Can I put my fingers inside your vagina?"
Yeah.
And it's supposed to be okay.
Right.
Our minds are supposed to conquer our brains, but that's why cervix is shut down in labor.
Yeah.
It's smaller. It's a myth. They only go one way. It's a sphincter. It goes both ways. It's like
right.
But for men then, okay, so cervical exam, I can see. So by the triage nurse, okay, by the first nurse, that's fine. Well, now the doctor's coming in and we're in a teaching hospital. So now the resident is going to put their hands in there. And then we have a shift change. So now we have another nurse, and I would say, even if you're in a small rural hospital, cervical checks by 2 people may be normative, 2 or 3. You get into a teaching hospital, you're talking 7 or 8.
Oh my gosh.
And the brain does not, depending upon how how long the labor goes and whether the person feels comfortable saying no to an additional examiner or not. So then we've got an IV, which is usually put in, not in the elbow, but it's put in the wrist, so with a hep lock.
Yeah.
So you have IV, you have fetal monitors, so 2 fetal monitors strapped. If the external fetal monitor isn't picking up the baby, they'll want to do an internal one.
Right.
Well, that means they're actually putting either a pressure catheter or an electrode up inside the vagina and putting it inside the uterus or attaching it to the baby. So now, out of the sexual organs, you have the internal monitor tubes and wires, and then those are strapped to the thigh.
Yeah.
If the laboring person decides to get an epidural, then you've got the blood pressure cup, you've got the pulse oximeter, you've got the IV, you've got the internal monitor, and you've got a bladder catheter. So there's another tube and wire coming out of the
None of this is giving a picture of this is all normal, healthy, natural, right? Like this has got to be, so it's raising my stress level just listeing to you describe this.
And this is typical. I mean, 65 to 80% of people, 65% of people have one of the big 5 interventions and 80% have 2. So induction, epidural, amniotomy, starting a cesarean birth or an operative delivery using forceps or vacuum extractor. So those are the big 5.
Yeah.
So we have 65% get 2 of those, 80% get 1.
Wow.
I mean, we have this high rate of interventions. Well, because of the way we interfere with the oxytocin flow during labor.
Yeah.
But one of the things that happens for men is that if they're able to comfort and nurture their partner and they're able to look in each other's eyes, they're going to stimulate their own oxytocin, and that oxytocin is going to help to calm them down. If they are able to touch their partner and interact in a loving way, not only will that stimulate oxytocin, it will also probably help to stimulate prolactin between the 2 of them, and that's going to calm the father down as well. So if he's interested in that level of touch, that can be very, very helpful. However, what our best literature tells us is that fathers really, really like epidurals. And this shows repeatedly over and over and over again because, and this is several different countries, the US, Italy, Sweden, that it seems to be bringing something out of control back into control.
Mm.
So, and that spontaneous labor sounds sexual, it looks sexual, and it is sexual. And then when you put an epidural on it, you've taken that away because you've interfered with the beta endorphins and the oxytocin flow and the experience. And somebody comes back to their cerebral cortex.
Right.
So for somebody who's anxious, it's like, okay, this looks better. This looks more medical, more predictable to me. I know how to relate to this, and I didn't know how to relate to the spontaneous labor before.
Yeah. So talk a little bit about the sex and the sexuality of birth, and how that is for men who are watching this, and maybe this leads into something you said you wanted to talk about, which is what about men who struggle with attraction after this too?
Mm-hmm. Yeah. And a lot of that has to do with, well, what am I looking at? What did I see? And how is he dealing with that privacy or primacy of her genitals belonging to him or being his space to now being public or being now. And so one of the things I say as part of that healing or integration period afterwards for men is like, as women, we relate to our genitals in a variety of different ways because we have to use them for urination. We have to use them for our periods. We have to use them for having babies. We have to, there's lots of stuff going on down there. And we also are used to our body shifting and changing because we go through, a monthly cycle at some point in someone's life, even if they've been on birth control, suppressive hormones, at some point in their life, they went through this particular cycle. Right. So we're used to that. Men don't have that. They're pretty much steady state their whole lives. It's like boom, 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 boom. It doesn't shift and change. So I think for a female-bodied person, it's easier to assimilate that oh, okay, so now my genitals have been used in this particular context as well.
Right.
Or, I've had pap smears or I've had cryosurgery on my cervix. It's like, okay. But for the male partner, they've only seen female genitals in one context, and that's sexual. So to be able, they have to, as part of that integration period, they have to expand around that and say, it's okay for them to be in this whole other context. And I can relate to them sexually as well as these genitals giving birth to a human being. You know, for some men, watching the baby come out is incredibly stressful. And for others, they find it's a wondrous thing. You know, it's like, wow, that was amazing. I love you all the more because of it. But I think a part of that process of maturity and integration is being able to say, okay, the genitals are capable of a whole heck of a lot more than just this one way I've been seeing them.
Yeah.
You know, but if they've been violated, if the person has had an episiotomy, if they've had vacuum extraction, which is putting a silicone cup inside the vagina on the baby's head and then using pressure, and then when the laboring person is pushing, then you're pulling on the baby's head with the vacuum. So it's supposed to assist the passage.
Right.
Or using forceps, which look like salad tongs. You would have put a spoon on either side of the baby's head. So if you can imagine a baby's head and then this medical equipment also in the vagina, it's overwhelming. Yeah. Because at this point, if that equipment is being used, there's some difficulty with the baby emerging.
Right.
There's some get the baby out. So there's stress and tension in the room on the part of the medical people. So you've got this worry, is everything going to be okay? Is her body going to split open?
Yeah.
Is it going to be damaged? Is she experiencing this as a violation or as helpful? You know, so there's all these different things that are going through men's heads at the time when this is happening that then have to be reconciled in order to relate to that same body and that same body area in a sexual way with an erection, hopefully.
Yeah.
You know, because that's what we expect. So, and it can take time. Also, medical people give messages about bodies.
Yeah.
Oh, this baby just doesn't want to come out of here. Baby blaming. You know, or for some reason you're just so tight down there, or your pelvis must be twisted, or I've never seen anybody have a problem having a baby like this before, or I mean, I'm trying to recall all the
all the different messages,
and sometimes medical people think they're being helpful, but they do give messages about bodies.
Yeah.
And also, if they're uncomfortable with the sexual expression of the couple during labor, if they get too kissy huggy or whatever, ooh, that's what got the baby in. We don't need that today.
Oh, gosh.
So, yeah, subtly shaming comments when people are connecting, and because of their own discomfort. And I don't think medical people realize sometimes the impact of what they say. And because of the neurohormonal state and the way memories are laid down during labor, I don't think they realize that those remarks last forever.
Yeah, and it's interesting because I think you're also saying that birth is an inherently sexual process, and if we allowed the hormonal and interactions to proceed, you know, it would be a more sexualized experience. Like, that's all helpful for a birth, and it sounds like helpful for the couple to get through that in a solid way. But it may very likely be tamped down by the medical interventions in the staff, right? So that they're cutting off access to something that would make this whole thing be less stressful and go easier.
Mm-hmm. One of the women in my study said to me, what I wanted during labor, I wanted my husband there, but I didn't want my husband taking care of me, because when he touches me, it's sexual. And that's not what I wanted during labor. I wanted somebody to nurse me, like my sister. So, and that was the word that she used, that word of nursing, that caretaking, that she didn't want to have that sexual component during her labor. And so I think when we can explore that with people ahead of time, like, I'm really reluctant to put a whole nother pressure on people. Oh, now you have to have a sexual birth, you know?
Right,
now it's like, no. You don't have to do anything but what feels right to you to get your baby out in a way, in an arena that feels safe, where you are supported. I mean, I think the number one thing that men really need to do is the same thing that your husband does, that you did, was bring somebody else with you.
Yeah.
You know, whether that, if you can work with a doula, that's great, but not everybody's going to have access to that or want that. But to have someone there who's hopefully knowledgeable about birth, and that helps the father feel safe and comfortable. Like, I can ask questions. If I need to leave for 5 minutes, they're not going to give me a hassle about that. They're going to understand that.
Right.
Mm-hmm.
So you also, I think, wanted to talk a little bit about how having a doula or that kind of support person can make a difference in people's sexual life after birth, right? Like, obviously they're helpful during the birth itself, but what's the contribution to the sex life after?
I think during the birth is the main thing, because you lower that level of arousal. I mean, I've seen it. I mean, with the people that I've supported, that if he doesn't understand what's going on or why, it's like all of a sudden it's from 0 to 60 miles per hour. It's like, I need to protect my wife here. I need to make sure things are okay. And it's like, no. This is all right. This is okay. What you've seen here. Because men often feel like they need to be in that protector role during labor, but they're not quite sure how to express it or who to express it to, because they don't have that knowledge. That's why I think, and have a walking encyclopedia of birth with you, that's really where the doula or the knowledgeable friend can be most helpful. Afterwards, I found that even with people who I was not their doula, that when I sat down with them and talked with them about what happened at their birth, that relieved a lot of the stress and the anxiety that they were feeling.
Okay.
Because the person in labor, the brain is effective, so it doesn't remember time. Time becomes elastic. That's a part of the hormones of birth, the way it affects memory.
Yeah.
The way memory is laid down. But for men, they just because they're living through it and it's so intense that they don't recall this timeline as well.
Huh.
So I found that happens several times, because I did a study where I was interviewing people who had a hospital-based doula. So they walked in labor and were asked, do you want a doula? Well, what's a doula? Well, here's what a doula, she'll be with you, help you with comfort measures, help you explain to you what's going on. And if you don't like her, you can send her home. And she's free? Yeah. Oh, yeah, for sure we want a doula.
Yeah.
So we had a doula, and then I showed up about a month or 2 months later and then interviewed them about that. So it was through that process that I learned that men don't keep a timeline either, about how much they need to be debriefed about what happened at the birth and why, and what was their role in it, and could they have done something different?
Yeah.
Maybe not. Oftentimes it's maybe not, because they don't have the power. The patient has the power.
Yeah.
And that was also where I got it in my face about that men could be 100% involved in the birth and not do anything in terms of labor support.
Right.
And that's can be fabulous for the couple.
Right.
I mean, I really want to divorce this idea that men need to be responsible for labor support, because it puts a huge burden on them. That, I mean, I do a 34-hour course for people who want to become doulas. It's 34 hours with me in the classroom. And then they need to go out and attend births.
Right.
Now, what dads get, and that's how to be a doula. And most of that is focused on getting along with hospital people, comfort measures, positioning, emotional support. What if things get hairy? What do you do in this situation? What do you do in that situation? So we cover all that. And then poor men, they get 6 hours in a childbirth class that's spent on labor support? And that's
which isn't really about labor support either. I mean, a fraction of it is, but
Right.
Yeah.
Well, I'm, saying, okay, you get 2 hours on comfort measures, you get another hour on positions, you get maybe another hour on here's what to say, what not to say, and including practice time with all of those things.
Right.
And we expect them to perform at the same standard as a professional doula. And it's like, no, guys, take that off your shoulders, because it's such a huge burden.
Yeah.
And so I think that there's a lot of blaming that also happens in relationships afterwards.
Yeah.
My colleague Ruth Anchetta was a part of Bruce Flam's VBAC study, and she interviewed over 2,500 women who'd had an unexpected cesarean, and they're now pregnant again.
Okay.
And this was done a couple of decades ago when she did the study. But what came out of that for me was how many women blame their husbands for not protecting them. You didn't keep me. You and the doctor colluded against me. You ganged up against me. You didn't know, and he didn't know what to ask. He didn't know that there was any other route. But, the cesarean seemed like the right thing to do at the time. I mean, and so to put that huge burden on him that puts the burden in the marriage. See?
Yeah.
Afterwards, and it puts it on the sexual life afterwards. So I think when you're find yourself in a position where you're making those kinds of critical decisions about surgery, about using internal monitors, things like that, that men are out of their depth, but we don't let them know they're out of their depth. Our expectations are so great that your average man there's no way he can live up to them. He's already starting out in a one down position because he can't take care of himself, manage his emotions, manage seeing his partner in pain, advocate for what their wishes are, talk to the nurse and ask questions because he doesn't have the knowledge bank, to be able to know and ask questions. There's just so much happening.
Yeah.
Because our birth system isn't set up optimally. So that means that we have to go in and try to individualize care in a system that's set up for mass care of moving great numbers of people through the system.
Can we wrap up with what advice you would give to couples, to fathers now who are struggling sexually because they've had a difficult or negative birth experience? Because, I mean, you're talking has raised my stress level, and I have way more compassion for the dads in the room. And that's just for sort of, normal birth that goes well. But imagining, the stress and the challenges is way greater if something's really gone wrong or been super difficult.
Or if her genitals have been damaged in some way, because that happens in about 2% of births. People will end up with extended perineal trauma, or they end up with nerve damage from the vacuum extractor, from the forceps. And that has a lot to do with birth position. Mm-hmm. We use the worst possible position for birth and the one that maximizes the possibility for damage, which is the semi-sitting position, because the most flexible part of the pelvis is the tailbone.
Yeah.
And we have people sit on it.
Yeah.
It's dumb, but it's a leftover because that's what OBs learned to do 100 years ago, or if 70 years ago, and they're still doing it. They don't learn that birth position matters. So anyway, I think that one of the first things to do is to realize, hey, I'm having a difficulty. I'm having a difficulty relating to you sexually after what we went through. And not to blame the baby, that the baby coming home and getting to know this new person is a whole nother project.
Right.
That we've taken on. Okay, getting to know them, figuring out how to feed them, figuring out how are they communicating to us, and what's our household rhythm going to be. So you've got that whole business going on. And then you've got, I've got all this leftover from the birth here that I have to figure out how are we going to relate to each other? How am I going to relate to you? Do I relate to what I saw and how I felt about what happened to your genital? Yeah. And so I think the first step is just saying, hey, I have a response to that there's something going on, because I think that it's usually just buried.
Yeah.
We don't talk about it. It's not something that happens at the family barbecue on Sunday. It's like, oh man, I just had to watch Jill give birth. Can I talk to you about what that was like?
Yeah.
And Jeff Foxworthy has made a joke. It's like watching a Saint Bernard come in the house through the cat door. That's what he said watching birth was like. So we have a joke. And then you've got Noah Wiley, who says, it was the most amazing experience of my life. I will never forget it. The way it smelled. He talks about the smell of birth and everything. Wow. And it's like, okay, so we've got Jeff Foxworthy over here, and we've got Noah Wiley over here, but I'm just your average guy in the middle.
Yeah.
How do I do this? So acknowledging, that's the first thing. Acknowledging that you have feeling. 2, talk about it with somebody who's knowledgeable about childbirth and can help you figure out what happens.
So again, you're recreating that timeline, that experience.
Right, because we want to adjust that cognitive appraisal. Was that really a danger? Was that really a problem? Right. And adjust that, because it's that cognitive appraisal that makes the difference. And you want to do that in the first couple of months, because if you wait too long, then you get PTSD showing up.
Okay.
The impression time is in that first few weeks to I would say 8 to 10 or 11 weeks, if he can talk about it with somebody there who can help him make sense of that story and understand what happened. Then I think that talking to another man who's been through it is also helpful. And I think sometimes if you look around in your communities, that you can find that man who's a father several times over. And if If he keeps having children, then we know that he figured out how to relate to his wife sexually again, right? Because they're continuing to have kids. So I think then looking around for those leaders, those people who you feel you can be vulnerable with, that you can have that conversation and say, how did you traverse this territory?
Yeah.
That men need to look for their own elders, and they need to start talking about it amongst themselves, because that's where they're really going to find power, or they're really going to find consciousness raising, and where they're going to tell other men how to take care of themselves, so they don't have to go through this period of being ostracized and fearful and think that there's something wrong with them. Because that's the other thing, is there's nothing wrong with you for feeling negatively or having to reconcile, to come back and reconcile your sexual feelings towards your partner after you've been through a difficult birth.
Right.
Or even what to me would be a straightforward birth may be entirely difficult for somebody else.
Right.
So, because, and so I think that being willing to be vulnerable and take that risk and to have those conversations, once you understand what happened and you can put it in a context, and then I think being willing to explore intimacy, and they'll have to figure out, is this something that I want to share with my female partner or not? Or when do you want to do it? Because you don't want to do it in a way that's going to put another barrier between the two of you.
Right.
So I think that's where a counselor or a therapist can help.
Yeah.
If you need that as a couple, I don't know how to tell you about what I experienced. But also, I think realizing it's a setup. It's a setup there for you to have a neutral or negative experience. It's not a setup for you to have an optimal experience.
Yeah.
In the rest of the American, we do birth. If you do end up with a great experience, it doesn't affect you negatively. Man, you slid through.
Yeah. You got lucky, right? Yeah. Yeah.
Right. Yeah. Right. After doing this for almost 40 years, I've talked to a lot of people who've been affected. Yeah. And as well as care providers. As well as care providers that have been shifting and changing how they work, because they don't like the way the system is either, how it treats people. So
great. Mm-hmm. Well, thank you so much for this conversation. It was really enlightening.
Well, thank you so much for asking me. I really appreciate it. I mean, it's one of my areas where I really feel like we need to blow the whole thing open. We need to blow the lid off of this, because I think once we do, we're going to have much bigger shifts in terms of satisfaction and in terms of how people are relating to one another afterwards, with just a much greater level of honesty and connection. Yeah, I think that's what's really lacking, is this sense of connection for men around the experiences they've had doing labor support and being present at birth.
Right. Well, thank you so much.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get-to-know-you and question and answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.